What is the ADR surgical process? The artificial disc replacement process. How does this start? First, if you want to see an artificial disc replacement surgeon like me, often we may ask you to send your films in. I sit here, I review the films and your symptoms, a brief summary, and decide, are you potentially a candidate? Then you come in for consultation. I examine you. We go over your studies. If I determine that you are a good candidate for artificial disc replacement, then we schedule the surgery. My scheduler gets authorization. We book a date and time that works for you and your family and me. And then we proceed with the operation. Meet that morning, usual stuff, nothing to eat or drink after midnight, operate in the morning, do the surgery. Each artificial disc in the cervical spine is anywhere from 45 minutes to an hour. Lumbar spine, approximately 1 hour for each disc. And then the recovery will be, I check a wound in 2 weeks. I usually begin physical therapy and take x-rays at 6 weeks. And then you return back to your normal life. You'll feel great at 3 months to 6 months. You'll feel amazing by then. At least I did with mine.